For my instructional speech, I'll be explaining the steps of post-mortem autopsies. I'm going to be using a PowerPoint to display my visual aid. And before I start my speech, I just wanted to make my audience aware that I did choose less graphic images than what you can find online, but they can still be considered uncomfortable as well as my topic in general. Every individual has a right to order an autopsy under certain conditions, but yield the understanding of how a post-mortem autopsy is performed or even its purpose. An autopsy is the examination of a cadaver after its death with the intention of determining the cause and manner of death. Autopsies are used only in extreme cases or forensic purposes and are viewed as an ultimate branch of medicine. There are two main types of autopsies: forensics and clinical. Forensics or post-mortem autopsies are performed in cases of suspicious, violent, or unknown causes of death, while clinical autopsies are performed in the hospital by a pathologist based on the consent of a relative of the deceased in order to find a better understanding of the causes of death. The information provided in this speech will be focusing on the forensics or post-mortem autopsies and how they are performed, which usually takes 2 to 4 hours to prepare or perform. The pathologist starts an autopsy from the outside of the body and works their way inwards. Therefore, this first step of the procedure is an external examination. All the observations from this point on are then written down and recorded verbally. The pathologist will first look at the outer appearance, including clothes and accessories. Characteristics such as weight, height, eye color, hair color, texture, length, ethnicity, sex, and approximate age are documented. This information can help provide evidence to support an identity of the body if an identity hadn't been confirmed yet. The body will then be fully exposed to start the process of careful skin examination. During this, a pathologist will look at any evidence that can be used to determine what caused death, including gunpowder residue, flakes of skin, paint, injuries, scars, tattoos, and any other identifying marks will be examined. The second step of autopsy will be internal examination of the body, which will include viewing the internal organs, removing the internal organs, and removing the brain. The first standard step of this procedure is an order of x-rays that can be used to assess whether there was any abnormal bone structures or foreign objects within the body. For maximum exposure and optimal examinations after incisions are made, the body or the torso is then placed on a rubber block. That way the body is then stretched out. Careful incisions are first made to start the examination of the chest and abdominal cavities as well as the brain. The chest and abdomen are accessed through Y incisions, which is over here. The Y incisions will start at the shoulder, then meet at the sternum, and then will end at the pubic bone, which you can see in this diagram. The majority of organs are then taken out of the body to be examined individually. Depending on the type of autopsy and previous evidence, body fluids including blood, urine, bile, eye fluid are tested from anything from drugs, chemical, genetic composition to infection. Tissue samples are also taken. The organs are then either preserved for teaching or for research purposes or placed back into the body. Another more concentrated external examination will take place to determine whether or not there are any signs of head injury when moving on to the head area. Here is another diagram of the Y method incision. The brain is then reached by making an incision from ear to ear in the back of the skull, or by a triangular incision across the top part of the skull. It is first examined inside the body and then removed to be examined further, just like other organs. Some of the other organs, but especially the brain, are often placed in formalin for a number of days before the dissection takes place. This is done to allow the organs to become more firm, and it increases the ease and precision of the dissections. The last step consists of sewing up the body. Before the organs are returned, they are placed into bags to prevent leakage, and the inside of the body is lined with a wool-like substance. The breastbone and ribs are then returned after the incisions are made. So they're returned back to their original positions, and the body is stitched back up. This way, none of the incisions will be visible after burial preparations have been made, and at the end of the procedure, an in-depth report is written. The report will contain all the observations made during the procedure, as well as explanations of any of the findings and results. It also gives a medical diagnosis and a detailed summary of the case, explaining how conclusions were drawn. Primarily, results can be released within 24 hours, but the full results of an autopsy may take up to 6 weeks to prepare. Although every autopsy will have these same steps, it is important to note that each autopsy will be unique depending on the purpose of the procedure. Forensics pathologists need to follow all these steps in order to properly diagnose a cause of death and provide individuals who ordered these autopsies with correct information to determine further decisions and to even provide some kind of closure. Every individual has a right to order an autopsy from a licensed professional to determine the cause of death of a patient.